Here's a crash course in acute tubular necrosis. First, let's break down the words. Acute means that it happens suddenly. Tubular are filters throughout the kidney, and necrosis is death of cells or tissue through disease or injury. Acute tubular necrosis is a disorder involving the tubular cells of the kidney through injury or ischemia, and it causes the cells to slough off. As these cells build up in the tubules, they become clogged, no longer being able to filter and produce urine appropriately. This is the most common cause of intrinsic acute kidney injury. There are two types of ATN. Ischemia, which is secondary to hypoperfusion, which can be from shock, sepsis, stroke, myocardial infarction, blood clots, or surgery. And the second is nephrotoxic injury, which can be from drugs like aminoglycosides, acyclovir, or cyclosporin. What do the kidney tubules do? The tubules of the kidney filter the blood, returning nutrients and fluids back to the blood, while remaining fluid becomes urine.
So this is our kidneys up here. We have each kidneys and the renal pyramids. Inside there's the medulla and then the outer cortex area. So our nephrons are located in the cortex and medulla. They're everywhere and come in very large numbers. And then our tubules are inside those nephrons. So the normal function of the kidneys is going to be to filter and excrete waste materials from the foods, the meds, and the toxic substances that go through our body. So they're going to cleanse the blood of toxins and transform that into urine. So in other words, the kidney metabolizes relatively harmless agents and into toxic metabolites and gets rid of them through the body, out the ureters here. And the tubules specifically help filter the blood when it passes through the kidneys. And so due to the kidneys having a rich blood supply and their ability to concentrate toxins at high levels, that makes them extremely vulnerable to injury or illness.
There are 3 stages of acute tubular necrosis. The first stage is the initiation phase, where glomerular filtration rates drop to significantly low levels. This is paired with a rapid rise in creatinine and blood urea nitrogen, along with intracellular sodium and calcium accumulations. The second phase is the maintenance phase. Low levels of glomerular filtration rates stabilize with a plateau in serum creatinine, along with the blood levels. This can last a few days up to 3 weeks. The recovery phase, as tubular function is restored, urine volume increases. This helps to move blood and creatinine out of the system, restoring all the levels to pre-injury.
Signs and symptoms of acute tubular necrosis. One of the main symptoms is muddy brown urine, kind of looks like tea. This occurs when there's an excess of bilirubin in the urine. There are also common symptoms of jaundice. Okay. One of the first signs of tubular necrosis is the unusual color and odor that comes in your urine. There might also be differences in your flow of urine and the amount of urine that you pass. Some people might even notice some blood in their urine, known as hematuria. And that is common. It is also a symptom of kidney stones, so it's very important that you get that checked out. There's also common for clients to have pain with elimination of urine. Another symptom of acute tubular necrosis is abdomen or flank pain. It is very common for people to feel pain in their costovertebral angle on their back and kind of wraps around to their stomach.
So the impact that acute tubular necrosis has on the kidneys, which is the organ and system involved in this case, is going to be the kidneys get damaged from the flow of blood and oxygen that's being compromised from all the toxins built up and not able to get filtered out by the tubules. So this is due to cell damage or cell death of the tubulars tubules via either an ischemic or a toxic event that was described earlier. So destruction of tubular epithelial cells causes a suppression of the kidneys and renal function, and this is going to lead to low urine output, a decrease in glomerular filtration rate, or GFR, which allows toxic substances to build up, and then this can lead to, in the end, acute kidney failure. So as far as a head-to-toe assessment goes, we're going to evaluate for several different things. So we would evaluate for swelling and fluid retention, which could be anywhere in the extremities. And then we're going to evaluate for any nausea or vomiting, and then any drowsiness or confusion, and any muscle weakness. So we would do a focused assessment on the genitourinary system, which would involve looking at their low urine output and then any pain or abnormal assessment findings in that area. And then we'd also want to look a little bit into the cardiovascular system. So we'd want to like listen to their heart because this can cause things such as tachycardia or cardiac arrhythmias. And then we would also want to take a look at their skin, do assessment of the skin, looking for any signs and symptoms of bleeding, such as petechiae or echinosis.
Now that we've learned a little bit more about acute tubular necrosis, let's learn how to treat it. Unfortunately, there's no easy way to treat this. If a person is presenting with acute tubular necrosis and they are on a nephrotoxic drug, the drug would be stopped. Other than that, you can only support the symptoms. You can treat the hypercalcemia, hypomagnesia, hypermagnesia, hypotension, or hypertension, and add fluids. It has to run its course, unfortunately, and you can treat anything that's happening with your body around it, but running its course will take about 3 days to 3 weeks.
All right, for all you future nurses, here are some NCLEX questions that you might want to consider about when we're talking about acute tubular necrosis. So the first one is, after being filtered from the bloodstream by the glomerulus, this substance is not reabsorbed and is excreted through the urine. A, magnesium, B, creatine, C, calcium, or D, potassium. Now think about it really good. All right, did you figure it out? Well, it's B, creatine. All right, the next question is, a 52-year-old woman is admitted into the hospital. She has a massive GI bleed. What type of acute kidney injury is she at risk of developing? A, intrinsic renal, B, intrarenal, C, postrenal, or D, prerenal. Did you figure it out? It's D, prerenal. All right, here's another question for you. What are the stages of ATN? Select all that apply. Remember, select all that apply. Onset, B, oligaric, C, recovery, D, maintenance, or E, diuresis. Did you guess? All right, the answer is A, onset, C, recovery, and D, maintenance. Now, let's think about another question. What are 2 types of acute tubular necrosis? Select all that apply. A, toxic, B, acute, C, ischemic, or D, prerenal. All right, I hope you answered correctly because it's A and C, toxic and ischemic. Let's move on to another question. This disorder involves damages to the tubules, cells of the kidney, and it can lead to acute kidney failure. Now, we have A, polycystic kidney disease, B, acute tubular necrosis, C, pyelonephritis, or D, nephrolithiasis. Obviously, it has to be B. It has to be acute tubular necrosis because that's what we're talking about. All right, moving on to the next question. Prolonged renal blood flow blockage and the lack of oxygenation to the renal tubules will cause what? A, acute glomerulonephritis, B, ischemic acute tubular necrosis, C, toxic acute tubular necrosis, or D, acute kidney failure. Think hard. All right, did you think hard? Well, the correct answer is ischemic, B. Good job, you guys.
So the references we used for our presentation are going to be the Kosher and Herbs Fundamental Book by Berman, Snyder, and Franson, the Pathophysiology book by Capriati, and an online peer-reviewed article by Deep, Saxena, and Jose.
You can find more in detail on our paper that we put in. I had acute tubular necrosis when I took a picture, so I hashtagged it, no filter.